At our clinic, we get a lot of people attending with chronic back pain or a more acute attack of back pain. And in these people, we find there's an awful lot of muscle tension and splinting to protect their back. And what we want to do is teach them a program of exercises to activate the deep muscles that support your spine better, and then inhibit those other muscles that aren't really helping you at all. We find this helps them get moving better and also helps their pain. So I'm going to show you a progression of exercises now. So to start off, we have to get that deep abdominal, that transverse abdominis muscle to contract. There's a few cues we can use to help us do that. So we get in a comfortable supported position on the floor, and what I want you to do is find the front of your pelvic bones. There's 2 points there, and I want you to just come just inside of that with some pressure with your fingers. Now we want to feel that muscle contract. So the two ways we try and do that is we get your pelvic floor to contract by trying to get the feeling of stopping yourself from weeing. So if we try and stop that flow of urine, we can feel some contraction under our fingers and let go. You can do that again. Practice that a few times, making sure that we're not bearing down. We're just feeling that pelvic floor tighten, trying to stop ourselves from weeing. But you should feel those muscles contracting under your fingers. Another way of doing it, if you're finding it hard to feel that contraction, is feel like you're pulling your belly button back towards the bed or the floor. And again, we hold that. Remember, we always keep breathing normally as we do this, breathing in and out through our nose. I don't want you to tighten up or get too tense. It's a very gentle submaximal exercise to get that deep abdominal muscle working. And take 5 breaths in and out nice and gently for your hold and relax. And you can transfer this to sitting or standing as well. Now, as a progression, we want to put more load through there. We want to make it a bit more of a challenge for us. So the first thing we can do is get that contraction going just under our fingers, still breathing normally, and we can do some gentle pelvic movement, flattening and arching our back, and that just gets those muscles working in a nice rhythmic fashion and restoring some normal movement that might be lost because of pain. And again, I like people to do breathing normally, about 10 repetitions of that flattening and arching their spine. Have a break and repeat again, and that can be done 2 or 3 times during the day. The more the better, because you're retraining your brain to actually contract these muscles better. Once we've mastered that, the next progression I like people to do is, again, gently tighten up and activate your deep muscles, your transverse abdominis, and bring your hip up to 90 degrees. Hold that, say a count of 5, and down, and then the other one. Same hold, and breathing normally. Important to do that you're not rotating your pelvis or losing control of your pelvis as you're bringing those knees up. Now the next progression is to once again get a deep abdominal contraction, breathing normally, and you can slide your legs down and up just with the heel gliding along the ground in a nice controlled way. And again, working through that with a hold. You can rest in between slides, or you can hold and do a number of leg slides as long as you're breathing well. And again, a couple of sets of 10 are a good way to go. Now, those are the progressions we use for people with acute or chronic back pain to activate those deep muscles that support your back better. Now, if you've got long-standing back pain or severe back pain, go and see your physio to get the best advice. But if you have any questions or not sure about any of these exercises, feel free to comment below or contact us and we'll get to you personally to answer all your questions. Thanks a lot.